Thank you very much. Welcome to the first class of 72 Medicare Symposium, I guess we want to call it. But bottom line is, again, I'm here to share my knowledge. For those of you that aren't here, even if you don't live, I'm licensed in Indiana, Illinois, Michigan, and Ohio. But the company I'm with, we're a nationwide agency, so I can find help for you if you live in Arizona, Texas, wherever you're at. You can reach me on my cell phone. It's 574-361-4439. That's 574-361-4439. I do have business cards. Some people are sitting on them probably right now, but I do have business cards. Also, toll free to my cell phone is 866-411-4174. And my email address is Stephen, S-T-E-P-H-E-N, Holtz, H-O-L-T-Z, at healthmarkets.com. And I'm not one of these guys that live on the email. A phone call or a text are best way to really get my attention right away. I do check my email a couple times a day, but when I'm on the road, I don't really check it. And I specialize, really, is Medicare is my niche. I do the under 65 world, better known as Obamacare, but it's a mess. So I'm pretty well getting out of that. I am helping anybody who's a client of mine, or if you give me a referral of one of your children that really needs help, I'll help them, okay? But you'll see, I mean, I do a variety of life insurance products, cancer products. You'll see as we go through the slides, there's a lot of things that I do. I don't do cars and I don't do buildings. I have roughly 15 insurance agencies here in the Midwest. Somebody comes in and says, health insurance, Medicare or life insurance. They just say, call Holtzy. He'll take care of this. So that's really my niche. Dave, you want to flip a slide here? Yeah, this one here, it just kind of gives you an idea of everything that I do. You know, I do have an office. It's 1620 Cassopolis Street, right between the laundromat and that Phillips gas station. Tuesday's my office day. Other than that, I'm still a road dog. I'm trying to trim it back a little bit, but I still do 30-some thousand miles a year. Next slide, Dave. You know, you've seen the commercials of the Language United, AARP, United Healthcare, where they plowed through the bushes and take the mystery out of it. And that's really what I do. I feel that when people leave my office, they have a very good understanding of actually what Medicare is, how it works, and how it'll work for them. This gives you an idea. I mean, when it comes to Medicare, here in Indiana, I represent AARP, United Healthcare, Aetna, Anthem, Cigna, Humana, Mutual of Omaha, and several different drug programs. Most, you know, if you got a good insurance agent that's taking care of your car, that's taking care of your house and all that, most of them, if they do anything in Medicare, they do supplements. The reason why they do supplements is once they pass that one test they have to take, they're done. I represent all these other companies. I do drug plans. I do Advantage plans. Because every year I have to do 4 to 5 hours of continuing education for each company I represent. So in July and August, it's ugly. I just have to sit at my computer, take these tests, get recertified for everything. But that way they know that the person that's sitting down with you really knows it. Whereas supplements have been the same since 1966, 67, since they developed it. You know, it boils down to budget. I mean, anything you can think of, I do. We'll get into it, but, you know, areas, cancer is really the big one. More and more cancer treatments are a pill. I got 2 clients, $10,000 a month is their cancer pill. One, we got her in a program. The other one has some assets, so she blew through the donut hole and all that happy stuff, and now she's paying $500 a month. So I do a lot with, I just straight cancer plans. You get cancer, I hand you a check for $15,000. I can't do it after the horse has left the barn, though. anything you can think of. Another area, long-term care is kind of is a mess right now because they can't ever get the pricing right. It goes up and down. I have some hybrid products that can help you. Like myself personally, I'm a single dude. If 2 of the 6 things to live, toilet yourself, feed yourself, clothe yourself, move out of a chair, whatever. 2 of those things go wrong. I got $600 a week for 52 weeks coming into me to pay somebody to help me. That runs me about $36, $37 a month. So anything off the wall, anything you can think of with people, I do. Medicare, A and B. All right. This is kind of really where we get to the meat and potatoes of Medicare. All right, Part A. You had to have worked at least 10 years, over 40 quarters to qualify for A. So when you see your pay stub where it said Medicare, that's what you were paying into. Then Part B. When it comes to Part B, that's visualize outpatient services, going to the doctor, things of that nature. The government regulates what Part B costs. Part B right now for 2019 is $135.50 a month. In a future slides, we'll get into how I get Part B, what do I have to do, what if I'm not drawing my Social Security, so we'll get into all of those things as well. All right, what do we got? Okay, who's eligible for Medicare? Obviously, you turn 65, you're eligible. If you have good insurance through an employer, they're going to give you your Part A. Okay, you're going to get a card that has A and B on it. If you like what you have through your employer, then you need to take that card and you'll see where it says then you mail it back to Medicare that you don't want your B. Otherwise, they're going to give you the B. That's where it's very important to talk to your human resource people about how they handle somebody who ages 65. Some companies, they want you out of there, man. They want you out of there now. You're costing them money, man. We don't want you to hurt our group rate. So that's where it's very important, if you're employed with an employer with good group insurance, talk to your human resource person. Find out exactly how they operate. After you find that out, before you send that card back, you have a window to do that. Talk to me, and because sometimes the group plan isn't that good a plan. But I'm going to tell you, yeah, do the group. I got some retirees. They bring a plan in. I think it was Verizon. Yeah, keep what you got, man. Yeah, that's a good plan. So that's step one. Anybody who is drawing Social Security right now that started at the age of 62, they will automatically mail that card to you. Okay? If you're drawing Social Security, they'll automatically mail it to you. If you are not drawing Social Security, then, okay, Part A, hospital. That's all you're going to the hospital. That's all in your Part A. I don't know, it gets into, is your spouse eligible? Things like that. Bottom line is, if a child is getting assistance and has issues, they're probably on Medicare disability. So that's one thing to look at. And if you're also on Medicare and Medicaid low income programs, I have some great programs that cost $0 that can help you through those type of plans. Okay, who's eligible? Again, 10 years, had worked 10 years, or qualify under your parent, your spouse. And if you don't, it's $437 for A. There are some, usually I'm dealing with farmers or things like that where they never really paid in to Social Security, to Medicare. They're stuck paying for their Part A. Medicare by itself, A and B, On the hospital, it's a $1,000, if you go to the hospital, you have a $1,340 deductible. That's what you're gonna pay, whether it be day one, you're in the hospital one day, or you're in the hospital 50 days. It's $1,340. And again, that's where we have programs to help pay that. Okay, skilled nursing, they cover up to 100 days of skilled nursing. That's where I have programs. They cover the first 20 days. I have programs to cover the next 21 through 100, because this shows that you pay $160, $170 a day for skilled nursing. While you're on hospital, one area that hospitals are playing a game with people, if you hear the word observation, what that means is you could be in the hospital for a couple days, but they've had you in what's called observation. You haven't been admitted. It's a game the hospitals play, because if they put you in the hospital and have you and admit you, you leave and you come back for the exact same thing, they get paid less money by Medicare. They get paid less money. So they do play this observation game. But if you haven't been hospitalized for 3 days and you've been in observation, but yet you're not ready to come home, and you go to a skilled nursing facility, you're footing the bill. So definitely scream bloody murder. Either admit me or get me the heck out of here, okay? So observation is a very key word with hospitals. If you're in the emergency room and after 20 hours, hey, you gonna admit me, or what's going on? I mean, or your advocate needs to speak for you. Okay, Part B. Let me just kind of read this. Is original Medicare, and that covers your outpatient services, going to the doctor, having tests done, things of that nature. So that card by itself, A and B, covers 80% of your medical. There is no prescription plan with A and B. There is, if you're in the hospital and they're giving you drugs, there is prescriptions through that, but there isn't a prescription plan. So you can just do A and B and a drug plan. Nothing wrong with that. But then you're exposed to that 20%, and that 20% is not capped. So I've sat down with some people, and that's what they wanted to do. But then when I show them what the cost of the drug plan, where they can have an Advantage plan, it's less money than the drug plan anyway. So all right, Part B. $135.50 is the cost for B. If you're a high wage earner, I believe the plateau for an individual is $85,000 a year, or a couple is $170,000. Then it's graduated. You'll pay more for your Part B. I've had some clients who all of a sudden inherited some money, and the way how they inherited it wasn't through a death or a life insurance policy. The next thing you know, they're calling me up, hey, why did my Part B jump so high? It is based on your income. So usually it's a year or 2 years before you're turning 65 is what they'll base the Part B premium of $135.50 on. Okay? Again, if you make more money than $85,000 a year, and that is your modified adjusted income, not your gross. A lot of self-employed people, I got expenses, I pay for things, that knocks what your modified adjusted income is, not your 1099. So if you are a self-employed individual, know that it's based on, I don't want to say line 37, but I may be wrong. When you turn 65, I just had mine Monday, it's a welcome to Medicare physical. It all depends how your health has been. I had a good friend that he was having some issues when it came about, and they ended up finding they did correct me if I'm wrong, I want to say an EKG, and they found an aneurysm on him, got it taken care of. So that it's a free, and when it comes to this welcome to Medicare, anything that's free, I tell everybody in the waiting room, everybody at the front desk, everybody back there with the nurses and the doctors, and as I'm leaving, I don't want to see a bill. They love to code things differently because they get paid more money than your welcome to Medicare. That's another whole can of worms we can discuss, is how doctors code things. Never, 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 never pay a bill until you get an explanation of benefits either from Medicare or the insurance company. If even you get, because they got this thing called a computer that just spits bills out, okay? Never pay a bill until you get an explanation of benefits from the insurance company. Even if you get, by the time you get your second bill, you turn around, call the insurance company, customer service in the back of your card, and say, hey, on July 7th, I had this done. Well, we have nothing. Thank you very much. Turn around, call the doctor. Hey, this is where you need to send the bill. Would you process it? Because I'm not going to pay you until you've sent it to my insurance company. So keep an eye on that. This has kind of changed a little bit. In the past, if a Medicare card, red, white, and blue, that's what's known as a private fee for service. What that means is as long as the doctor or hospital accepts that card, they have to accept Medicare reimbursement. All right, so they get paid less until Medicare tells them what they're going to pay for this particular service. So if the doctor accepts that card, he accepts reimbursement. He does have the right to refuse Medicare. In an emergency, anywhere in the United States, they cannot refuse. But they do have a right to refuse. Most doctors, if you've been going to that doctor, they're going to take you. I haven't had any issues with that, but sometimes finding a new doctor, they only want to have X number of clients who are on Medicare. Go to the next one, Dave, please. Kind of gives you the ABCs, 80% coverage. Chiropractic service, sometimes that's a gray area. There is no really dental care in them. Hearing aids, these are things that are not covered. Hearing aids, routine vision, glasses and such, except after cataracts. If you know that if I'm winking at you, I'm dealing with a cataract in my left eye. Doesn't cover prescription drugs. And really, if you retire and you want to get the heck out of the USA and go to Mexico or go to Europe or something, see me. I have a couple companies that does very economical, that'll cover you medically overseas. Prime example, my sister, a little older than me, Libby, she still thinks she's a youngster. She was hiking the Alps a couple years ago, blew out her ankle. The group she was with went on. She had a concierge service that got her back and forth to the doctor and this and that, ended up having surgery, screws, plates, all sorts of stuff in her ankle. It was all taken care of. And the biggest thing, if you're overseas, if you die overseas, lots of luck getting your body back. And that's what this program, it's like I said, it's very economical. So don't depend upon Medicare to cover you out of the country. There's two paths to go down. I'm sure some of you are now getting Medicare and You. I don't read this page by page. If you do, hats off to you. But you turn right into the very first part of this Medicare and You. There's two paths for Medicare. Medicare Part A and B is your primary, and then supplement or Medigap and a drug program, or what you see advertised October 15th to December 7th, that's for Medicare Advantage plans. I'm going to touch base a little on them. I'm not here to get into particulars because each one of you is an individual. I'm not going to break any HIPAA or privacy laws here. That's why I meet in person. I have the ability to put whatever prescriptions you're on into my computer, and it helps tell us what's the best drug plan for you, or if the Advantage plan is good for you. There is no best or better. It's what is best for you, what works best for you, what fits your budget, what fits your needs, and kind of go from there. But that's about the only thing I use the book for, is that particular page, because it does the best of explaining the two different paths. Next slide, please. And that's really what's in the book. Medicare A and B with a drug plan, with a supplement. Just to touch base on, when it comes to supplements, the government says a Part F, Part G, Part N, all these different letters, no matter what company you're with, they have to be the same. There cannot be any difference in a supplement. It has to be, they're exactly the same. So then it comes down, I do some of the shopping for you. Then it comes down to strength of company, stability of rates, and how they handle customer service. That's really what it boils down to. Thank God I got this Health Markets. Again, I'm what's known as a captive broker. They do all the dirty work for me. They pick the companies that I represent. I don't spend a lot of time doing customer service. Biggest thing I spend customer service on is because the stupid doctor coded it wrong. I got this one little old lady in Hammond, Indiana. She loves paying hospital bills and doctor bills. She's always writing checks. So then we got to fight to get her money back. We get her money back. And at 85, she's worried about her credit rating. So I always tell her, what are you doing? I'm going to go out and buy a motorcycle? You know, what are you worried about? But anyway, again, don't pay a doctor bill or anything until you get your explanation of benefits, whether it's from Medicare or the insurance company. And then the right-hand side is Advantage plans. What an Advantage plan is, it's the privatization of Medicare. You're under all the protection of Medicare, but a private insurance company is handling everything for you. So if you're on an Advantage plan, you don't show your Medicare card. You have, it's usually an all-in-one Compass program that started $0 in this area, 0 to about $40 can get you covered in a HMO or a PPO, and I'll touch that soon. But basically, they handle everything. So you just have one card that does everything for you. Sometimes doctors have a little issue about Advantage plans. We all know, I can't remember the eye doctor who shot himself and then shot his wife a couple of years ago here because he got caught. 1.5 million Medicare fraud. Medicare by itself is the biggest fraud in the government that we have in our government right now. It's the easiest thing to defraud. So that's why a lot of doctors, because one, they got a private insurance company now. They're making sure what they're doing a little bit. They got Big Brother watching them a little bit, but I don't spend a lot. They won't cover this. No, it's none of that stuff. It's just do things right. Do things the right way. Okay, when it comes to Advantage plans, it's either an HMO or a PPO. PPO, Preferred Provider Organization. Gets you into pretty much a nationwide network. So finding, if you're a snowbird, you need to go to Florida, you're in Florida or Arizona or Texas or wherever you're in Mississippi, you're going to be down there for a couple, 3-4 months, no problem finding things down there. HMO, Health Management Organization, smaller network. Pretty much most things need to be done in the state of Indiana or the state that you live in. There are some programs out there that allows you to do what's called a passport, where you can say, hey, I'm going to Florida, so that then your plan kind of goes with you. That's not for every company. And the cost difference between an HMO and a PPO, you're talking $10, $15. I mean, it really, and HMOs of the past aren't nearly as restricted as they were, but I don't know. I usually seem to do mostly PPOs when I do Advantage plans. And I would say right now, my clientele, I would say I'm about 65% Advantage plan, 35% supplements. It's just, again, it's just what works best for you. Next slide, please, David. What is the approximate monthly premium? I don't remember this slide. Okay. Supplements, basically in our area, anywhere from $98 to, I haven't seen it, say $200. So remember, you got to pay your Part B no matter what. That $135.50 you have to pay. All right, so that's supplement. Drug plans, they run anywhere from $15 to $80 a month. Again, we input your prescriptions. When it comes to drug plans, and you're doing the route of a supplement, I just input your prescriptions into the computer, Medicare.gov, of the 23 drug plans here in the state of Indiana. It tells me which is the best one for you, whether I rep them or not. If that's the best one, that's one I'll put you in. The only caveat, if you have issues, I can't jump in and help you as much as I can do a 3-way call, and you can allow me to do the complaining for you or do the discussion for you. But I'm not an agent of record, so sometimes insurance companies get a little leery if they have somebody off the wall talking to them. But if you're on the phone with me, we can still get her done. And then when it comes to Advantage plans, they started really zero to about, and like I said, $0 to $40 in our area. Other areas, $0 to $75. It all depends what's in it. Usually, Dave, next slide. This is just a chart. If you go to Medicare.gov, it shows you the alphabet soup of supplements A through K and L, and not all of those are available in our area. Plan F. Your parents have probably had a Plan F with United Healthcare, because they were really one of the first ones involved in it. Come the year 2020, will not be able to sell a Plan F anymore. Anybody who has a Plan F can keep it, but I'm already seeing those rates going up higher. And what it is in the insurance industry, if you're not adding any more healthy people, it's what's known as a death spiral for that Plan F. Because you're not adding any more healthy people, so there's only unhealthy people. Now a supplement, when you're aging in at 65, or let's say you're working till 67, you have a good group insurance, and now you want to go into Medicare at the age of 67, you are in what's known as your open enrollment period. It's all based on when does your Part B start. Okay, so that's the start of your open enrollment period. When it comes to supplements, I don't ask you any health questions. None at all. Doesn't matter. You could have tubes coming out of your body. I've done plans with a husband and wife, and the wife's in there having chemo at the hospital because she's aging in. Hey, this is what we're going to do. Okay, but you have the ability. You're in your open enrollment. 2 years down the road, you want to look at a supplement, but you already had that pacemaker or that heart attack or COPD or cancer. You might not pass the underwriting, okay? So it is an underwritten product. When it comes to Advantage plans, and it is age-based, so the rates are based on the age that you are, and they do go up each year. When it comes to Advantage plans, it's the same rate whether you're 65 or 95. Plus, as it stands right now, the only health question, do you have end-stage renal failure? You're on dialysis. That is the only health question you're ever asked. So it's always easy to go from a supplement to an Advantage plan, but vice versa. I mean, if you're healthy, it's no problem. I mean, fairly healthy. Even if you could be on a diabetic, you could have had cancer 10, 12 years ago, you can still get into a supplement, but it's a little bit tougher down the road than when you're in your open enrollment period. I'm not trying to steer you into a supplement the first go-round. It's what's best for you, what fits your budget and fits your need. Myself, personally, I did a supplement because I'm still working. I like to keep it simple, stupid. So I know once I hit my $185, I'm done. But I'm paying $100 and $120 more a month than if I would have done an Advantage plan. Next slide, please. Associated with using Medicare continued. We kind of covered that. Go to the next one. All right, Advantage plans. You got to have your Part B. And again, here we talk about HMOs. Really, with an Advantage plan, you pay for things as you use it. You have copays. But you do have a max out of pocket. And they can vary anywhere from, $3,400 to about $4,500. There's roughly 28 million people in America on Advantage plans, and less than 2% ever hit their max out of pocket. My mom's a prime example. At the age of 93, she made the mistake of telling the doctor, hey, I just don't have the same pep. You got to know my mother, God rest her soul. So anyways, the doctor changed the med. Boom, in and out of the hospital 3 times on an Advantage plan. Each time it ran her about $1,100. again, she didn't hit her max out of pocket of $4,500. I didn't put her on an Advantage plan. She was on a supplement. When I put her on an Advantage plan, her supplement was getting up to around $375 a month, $50 for a drug plan, on a fixed income. I'm from a family of 8 kids. 5 of my brothers and sisters live in Colorado. They went out there before the marijuana thing, so don't think they went out there to puff. So I waited till one of my sisters was in town, laid out an Advantage plan for her, and this is when my mom was at the age of, I think, 87. And so it was a no-brainer. She went from over $400 down to $25 a month. All right, so we said, all right. When her check came in, $100 went to a separate account for 15 months. So $1,500 went into that account. It took her over 5.5 years to go through that $1,500 in her copays. And then a couple years after that, then that's when she got hospitalized. And she, little side note, she always wanted to donate her body to science, so we moved her to Colorado where all my brothers and sisters were at. She was the envy of the nursing home because there was a brother, a sister, a spouse, or a grandchild there every day, taking her somewhere. Everybody took care of her very well. The nursing home knew they couldn't get away with squat because there was a Holtz hanging out there all the time. So when she did pass, the University of Colorado of Medicine did take her body. So she was healthy to do that. And of course, I'm telling everybody now, when they cut her open, they found a little bit of white wine and some peanuts. So if you want to live a long life, little white wine at 5 o'clock with a few peanuts, and you're all taken care of. Again, HMO, you have a primary care doctor, and he tells you if you need to go see a specialist, he has to give you a referral. Go to the next slide, please. A PPO. Again, you need to go see a specialist. You just go see a specialist. It is a network, so you have to see a specialist that's in the network. That's probably one of the biggest things. Broader network. Most Advantage plans will have a little bit of dental, will have a little bit of vision, will have some, the prescription plan is embedded in it. And that's where, based on company and based on your needs. I mean, I have some companies that don't have really dental in it. I have other companies with an HMO, they give you $1,000 of dental each year. So that's where we just need to see if you got choppers in, then I guess you really don't need much dental. When it comes to vision, I don't do very much vision anymore because more and more are AM best. I got a lot of clients, they swear by that AM best. Free eye exam, 2 glasses for $72.95 or whatever. Now, if you need cataract surgery, you have something medical, then your medical insurance is going to cover that. Even on an Advantage plan, outpatient surgery, you might have a copay of $180 outpatient surgery. You slipped and fell on the ice, you screwed up your shoulder, it's a $15,000 surgery. What's it called now? Not OSMC anymore.
It's going back to us.
Oh, it's going back. Okay. Anyways, you go there, they do the surgery, it's a flat fee of $180. On an Advantage plan, you go to the hospital, you might have a copay of, $300 a day for the first 5 or 6 days, and then it's covered 100%. I do have product, that little policy for, $25, $30 a month, that can pay the hospital for you on that. An Advantage plan, if you use it, you have copays. If you don't use it, you're saving a ton of money, and I tell people to stash half the money they're saving for the first couple of years, and then if the proverbial hits the fan, there. And again, I can't stress it enough, cancer, no matter whether you're on a supplement, whether you're on an Advantage plan, cancer, it can cost you. I'm sure everybody here has seen what's going on in the world of cancer. More and more are a pill. If it comes into a pill, it's going to fall into your drug plan rather than being a medical. If they're doing chemo and radiation and all that somewhere, then you're covered. On an Advantage plan, you're exposed to about 20% up to your max out of pocket of $3,400 or $4,500 or wherever that particular plan has a max out of pocket. All right, Dave. I'm gonna stop right now, because I've covered a lot. We're almost done, but anything right now sticks out that somebody really needs to know something? All right, once I've talked so long, I'd just soon hear from somebody else.
First off, how about a round of applause for Steve?
Thank you, thank you.
Thank you, Steve.